Mr. President, members, we could have a healthy debate on single-payer system and universal health care, but that's really not really what this is all about. We could talk about the Canadian system and what's happening in the British Isles, the 800,000 to 1 million people on the waiting list in Canada, why members of the Canadian Parliament are coming to the United States for their cardiac care, why the Premier of Ontario comes to the United States for his cancer care, because the single-payer system in Canada has failed, while the Supreme Court of Canada has ruled that their system is not equal under the law, and that they have ruled that they have to come up with another tier or level of payment other than the single-payer system. That's the way we want to go? I don't think so. But you know, folks, the question here is this bill. Notwithstanding what happened with what the people said in Massachusetts, which, by the way, went to probably the closest single-payer system that we have in the United States today. And in that state, folks, physicians and dentists are leaving that state. Nurses are in acute shortage because they find that they cannot work under the tenets of that program. Waiting times in Massachusetts for appointments, up to 22 months to get an MRI if you have a hip or a knee problem in Massachusetts. And premiums to employers going from $8 now to $12 and being proposed to go to $14. Costs rising and benefits reducing, and that's what you get with a single-payer system. But this bill says all Californians must subscribe to the plan, that it is illegal to have health insurance except if you're a union member. If you're a union member in California, this bill does not apply to you. You can have a health plan and a health care plan that nobody else can have because you're not a union member. This bill has been a resurrection of Sheila Q's bill from 2 years ago. Nothing really different. Its cost is going to be over $220 billion, and the legislative analyst said 2 years ago, the first year, the deficit will be $40 billion beyond even that projection. And we're in a budget deficit in this state, and now you want to tack on a bill that is going to automatically put you in the first year another $42 billion, and in the year 2015, another $44 billion deficit? That's what this bill does, folks. And I guess what I'd like to do is give some advice to my Democrat colleagues. Legislators in this state and this body in this state ranks subpar to used car salesmen in the public's respect. And if you didn't get the message about what happened and what people were saying last Tuesday in Massachusetts, do yourself a favor. I'm running for public office statewide, and I would love you to pass this bill and keep pushing this bill, because that's going to help get me elected. Do yourself a favor, majority party. Stop this bill today. Show the people of California that we can do better. Yes, we have to address access. Yes, we have to address affordability. Everything is not well with the system we have, but you don't throw out the highest standard of health care in the world, which we have in California today, where people from other countries come and get their health care, and throw it out for this bill, which will be failed in the first year, and I will predict will put you out of office. Do yourself a favor, kill this bill today, and let's start from scratch.